cardiac vectors, how many cardiac vectors are there in a single cardiac cycle? There are 5. Okay, there are 5. So first is the atrial depolarization vector. Second is the septal depolarization vector, which is a small one, septal depolarization vector. And third vector is the apical depolarization vector. Fourth vector is the ventricular free wall depolarization vector. And the fifth vector is the posterior-basal part of the heart depolarization vector, right? So there are 5 vectors. So if we exclude the atrial vector, atrial depolarization vector, we are much more concerned with the ventricle, right? We are much more concerned with the ventricle. We are much more concerned with the ventricle. So we will see all the ventricular vectors. Okay. So forget atrial depolarization vector, which is oriented down and laterally towards the left, right? Down and left. So if we see all the ventricular vectors together, so ventricular vector, first vector is septal depolarization vector. In case of ventricle, it is first. Otherwise, for the total heart, it is second vector, right? Okay. So septal depolarization vector, which is a small one, which depolarizes the ventricular septum or interventricular septum from left to right. Okay. So this is very important MCQ. Your left ventricular septum, your interventricular septum is depolarized left side first. Okay. Left side of your interventricular septum is first depolarized, right? Okay. Now the apical depolarization vector, ventricular free wall depolarization vector, and posterior-basal part of the depolarization vector, right? Okay. So as we are calling it a vector, okay, as we are calling it a vector, it has got a magnitude and it has got a direction, right? So this is a small vector, not that much powerful, because it depolarizes only the interventricular septum, which is a thin muscle mass, right? Then this is a big one, third vector. It depolarizes the ventricular apex, however the muscle mass is more. Okay, so its magnitude is quite high. Okay, it is a very high voltage current. Okay, next is this one, vector 4. In case of ventricle, it is third vector, right? So it is ventricular free wall depolarization vector, and I told that both right ventricle and left ventricle are getting multiple small vector which depolarizes the right ventricular free wall and left ventricular free wall. But as left ventricular muscle mass is more, the resultant vector is oriented towards the left. Okay, the resultant vector is oriented towards the left. So this is the resultant vector which depolarizes both the right and left ventricular free wall, correct? And finally, very posterior part or posterior-basal part of the heart depolarization, it is again a small vector. Now, as per the rule of vector, we can shift the vector parallelly. Okay, we can move the vector parallelly. Okay, so if I start all these vectors from a single point, okay, if I start all these vectors from a single point, we get this. So this single point is the upper part of the bundle of His. Okay, upper part of the bundle of His, or maybe the location of AV node. Okay, upper part of the bundle of His. It is we are conceptualized in the sense that we are assuming that this is the center of heart. Okay, this is the center of heart, and we will move all the vectors from a single point, and we will move all the vectors. So this is the second vector, third vector, fourth vector, and fifth vector. Do you understand or not? Okay, so second vector, if you remember, was this, right? Second vector was this, the ventricular septal depolarization vector, interventricular septal depolarization vector. ऐसे था ना? तो इसको हमने parallelly shift किया तो ऐसे हो गया from this point, right? Apical depolarization vector was this, so इसको हमने यहाँ पर shift किया है, right? And starting from this point, we are getting this apical depolarization vector, okay? And this 4 number vector or ventricular free wall depolarization vector was this. This one was ventricular free wall depolarization vector, and we have moved it parallelly. So starting from this red point, right? And this is the posterior basal part of the heart depolarization vector. Clear? So we are starting all the vectors from a single point. Okay. We are starting all the vectors from a single point. Okay. Now again we are moving to ECG leads, right? ECG leads. Okay, so here was the triangle. Here is your right arm, here is your left arm, and here is your left foot, right? This vector is lead 1. Okay, this vector is lead 2, and this vector is lead 3. Okay. Okay, now someone tell me how to form lead AVF. How to form lead AVF? Yes, tell. Yes. So what I need to do? I take copper wires. Okay, I take copper wires. One I connect at RA. Okay, then another from LA. I'll make a common terminal. Okay, and with that common terminal, I will connect LF. Okay, clear? So it forms AVF. It forms the lead AVF. So AVF will be, LF minus RA plus LA by 2. Okay, RA plus LA by 2. Now, do you know what is this? What this triangle is? This triangle is called Einthoven's triangle. Okay, this triangle is called Einthoven's triangle, and although it is not an equilateral triangle, we will consider it as equilateral triangle, right? Okay, and the thing is, if you keep charges on this is a law of physics, in a triangle, in an equilateral triangle, right? কি বলে সমবাহু ত্রিভুজ তাই তো equilateral triangle. Okay, so if we place 3 different charges on each points of the triangle, okay, 3 charges. Okay, so here is the triangle, here is an equilateral triangle. Okay, so I am keeping charges on its 3 points, right? So q1 charges, q2 and q3, right? And due to this there is a potential there. Okay, so potential, say for example V1, V2 and V3, right? And according to the law, okay, V1 plus V2 plus V3 will be 0. Okay, this is Einthoven's law. Okay, so this is completely rule of physics, you know better than myself. Okay, so accordingly, if I apply this formula over here, RA, LA, LF, so RA plus LA plus LF is equal to 0, correct? Okay, so RA plus LA is equal to minus LF. Okay, RA plus LA is equal to minus LF. So LF minus clear or not? Are the steps clear? Okay, so AVF is called augmented. Very often you face this question in your first professional MBBS, very common question, frequently comes in first professional MBBS examination. Why these leads are called augmented? Okay, why these leads are called augmented? Because if you calculate AVF, potential at AVF, okay, the potential at AVF, if you calculate, it comes 3 by 2 LF, that means 1.5 LF, right? Correct? It comes as 1.2 LF. Clear everyone? So this is why these leads are called augmented limb leads. This is why these leads are called augmented limb leads. Very often this question comes in your fast professional MBBS as an explain why type of question. Okay? As an explain why type of question. Okay. Now, as the definition of lead is a pair of electrode and in between a voltmeter. Okay? We are measuring potential difference between 2 points by applying 2 electrodes at those points and connecting those 2 electrodes with a voltmeter. Right? We are measuring potential difference between 2 points. So, to satisfy the definition of lead, you need 2 points and you are measuring potential difference between 2 points. Okay. Now tell me, lead 1, it is measuring potential difference between RA and LA. See the picture? Okay. Okay. Lead 2, it is measuring potential difference between RA, LF. Lead 3, it is measuring potential difference between LA and LF. Lead AVF, it is measuring potential difference between RA and LA ka average point and LF. Correct? So in this way, you can tell the points, 2 points for AVR and AVL as well. Right? One example I have given, in this way you can tell, right? Okay. Now, as we can move the vectors parallelly, we can also move the leads parallelly and start from a single point. Okay. Now let's see. So first, see all the vectors, okay. So here is your heart, okay, here is your heart. The first vector is this, second vector is this, third vector is this, fourth vector is this, and fifth vector is this, right? 1, 2, 3, 4 and 5, right? Okay, now I can move the vectors parallelly, right? I can move the vectors parallelly so that I can start it from a single point. And that single point is the upper part of bundle of His or the upper part of interventricular septum, right? Okay, so I am again drawing a heart. Okay, so I will start from here. Okay, so first vector was this. Okay, so first vector is this. Okay, second vector is this, but I will start from this point, so it is this, right? Now third vector is this, but I will start from this point, so it is this. Okay, now fourth vector is this, but I will start from this point, so it is this. Okay, and the fifth vector is this, I will start from this point, so it is this. Okay, now I will remove the picture of heart. Okay. So here are the vectors. Correct. Here are the vectors 1, 2, 3, 4 and 5. Okay. Okay. Now the direction of leads. Okay. So in the triangle, Here is your lead 1, here is your lead 2, and here is your lead 3. Okay. But I will start from a single point, right? So here is lead 1, here is lead 2, here is lead 3. Clear? Okay. Now let us also draw the direction of the augmented leads. Okay. Here is AVF, right? Here is AVR and here is AVL. So these are the direction of leads. Okay. Correct. These are the direction of leads. Now I will superimpose the leads and the vectors. Okay. I will superimpose the leads and the vectors. So 1, I am drawing it in blue. Vector 1, vector 2, vector 3, vector 4, and vector 5. Clear? Okay. Okay. Now see this picture. Okay. Here the atrial vector is not shown. Okay. Here the atrial vector is not shown, right? Atrial vector is not shown. So we are focusing on the ventricular right now. Just forget atrial vector for now. Forget atrial vector. Okay. So this is the second vector. This is third vector, fourth vector, and fifth vector. Now in a conventional coronal plane, this is 0 degree, right? This is 0 degree and it rotates in this way. Okay. So what is the direction of lead 1? What is the direction of lead 1? 0 degree. Okay. What is the direction of lead 2? 60 degree, right? Direction of lead 2 is at 60 degree. Okay. Direction of lead 3 is 120 degree. Okay. Okay. So yeah, 120 degree, 60 degree, 0 degree, right? 0 degree lead 1, 60 degree lead 2, and 120 degree is lead 3. Now AVF is at plus 90 degree. Okay. Okay. So from 0 degree, this side is positive and this side is negative. So this is minus 30 degree. The location is AVL. Okay. AVL is at minus 30 degree. AVR is at minus 150 degree. And these are approximate degree of the vectors. Second vector, this septal vector, it is 170 degree. Third vector is 70 degree. And fourth vector is minus 10 degree. Fifth vector is minus 70 degree. This is approximate. It may not match in every individual, right? So it is an average normal direction of the vectors. Okay. Second vector, which is the septal depolarization vector, it is at plus 170 degree. Third vector is 70 degree. Fourth vector is minus 10 degree. And fifth vector is minus 70 degree. Approximate normal. Okay. Now comes one concept that is called mean electrical vector. तो ये जो चार वेक्टर आप लोग देख रहे हो फॉर द वेंट्रिकल ओनली, फॉरगेट एट्रिया नाउ. ओके, শুধু এখনকার জন্য অ্যাট্রিয়াটা ভুলে যাও, রাইট? পরে আবার ইয়াদ করবে, রাইট? সো ভেন্ট্রিকলে কটা ভেক্টর আছে? চারটে ভেক্টর আছে. ওকে, সেপ্টাল ডিপোলারাইজেশন ভেক্টর, এপিক্যাল ভেক্টর, ventricular free wall depolarization vector, and posterior-basal part of heart depolarization vector, right? So there are 4 vectors. So picture देख के ये बताओ कि which of the following 4 vector is the strongest vector? it is this one. Okay, this is the strongest vector. The more is the length of the arrow, more is the strength, right? Clear? So this is the strongest vector. Now throughout this 0.8 second of cardiac cycle, these 4 vectors are happening in a sequence, right? 2, 3, 4, 5, 2, 3, 4, 5, 2, 3, 4, 5. In ventricle it is happening always 2, 3, 4, 5, 2, 3, 4, 5, right? Okay. Now if we calculate the resultant of these 4 vectors, okay, if we calculate the resultant of these 4 vectors, to which direction that mean vector will be located? Yes. So it will be more or less located in this direction, right? It will be located in this direction because it is very small, right? It is very small. So it will be located in this. And this green color arrow is the mean of 2, 3, 4, 5. Okay. This green color is the average or the resultant of 2, 3, 4, 5. Clear? This green color vector, and it is called mean electrical axis of heart. Okay? It is called mean electrical axis of heart. Why it is so important? Why it is so clinically important? Mean electrical axis of heart. And whenever you are to interpret an ECG, যখনই তোমাকে কোনো একটা ECG interpret করতে দেওয়া হবে, your first job is to check whether the rhythm is sinus and whether the axis is normal or not, right? Whether the axis is normal or not, mean electrical axis is normal or not. Okay, so this is why mean electrical axis for a patient, for a cardiac patient, is extremely important. We always look for mean electrical axis from the ECG. Okay, so here mean electrical axis is located around. This is 30 degree, this is 60 degree. So more or less 45 degree or something like that, right? 40 degree or 45 degree mean electrical axis is located in this picture, right? Okay, and it is normal. Okay, it is normal. You don't know why it is normal. Okay, I am telling it is normal. Okay, okay. So what will happen when mean electrical axis will not be normal? Okay, what will happen when mean electrical axis is not normal? Okay, now if I give you the easiest example, okay, so first come to the circulation. Your left ventricle pumps blood in systemic circulation through the aorta, okay, and blood reaches all your organs, your heart, your kidney, your liver, your brain, everywhere blood reaches, right? Okay, through the aorta. So left ventricle pumps, blood is ejected into the aorta and goes to all the organs. It can perfuse all the organs, right? Lung, liver, kidney, brain, everywhere, skin, right? Okay, but it has got a resistance. Okay, this is called systemic vascular resistance. Okay, and your right ventricle pumps blood into pulmonary circulation, and it has also got a resistance, and this resistance is called pulmonary vascular resistance. Okay, it is called pulmonary vascular resistance, but pulmonary vascular resistance is much lower than the systemic vascular resistance. That means it is very easy for your right ventricle to pump blood into the lung through pulmonary artery, okay, but it is very difficult for your left ventricle to pump blood into systemic circulation because the resistance is high. Getting my point? Okay, now what will happen if I increase this resistance further? Okay, what will happen if I increase this resistance further? That means A patient of high blood pressure. Okay, a patient of high blood pressure where the resilience of the arteries are lost. Okay, normally the arteries are elastic structure. Okay, when left ventricle pumps blood into the arteries, into the outer arteries, arteriole, right? They are elastic structure. They are vessel wall, you know, tunica media, tunica adventitia, tunica intima, right? The layers. Okay, so due to presence of elastin and collagen, blood vessels are elastic structure. Okay, but this elastic property is lost in a patient of essential hypertension. Okay, blood vessels are sclerosed. There are different types of pathology there. You will study in pathology how blood vessel changes in their histology, right? Different types of sclerosis happens at the level of arteries. So these blood vessels are no more elastic structure. As a result, peripheral resistance will be high and it will be very difficult for the left ventricle to pump blood into the systemic circulation. Okay, as a result, there is remodeling of the heart. Okay, how to do the remodeling? Okay, you are doing 10 kg biceps curl. Okay, you are doing 10 kg biceps curl and you are doing it easily. Okay, now your gym trainer has given you 15 kg and asking you to lift it. Okay, biceps curl, and initially you are not able to do so, but in the course of time, gradually you lift 15 kg. Okay, what happened that you are now lifting 20 kg? What happened? Yes, your biceps has got hypertrophy. Your biceps is bigger now. Okay, your arms are bigger now, so that you are lifting 10 kg, 20 kg, 25 kg, right? You are able to lift, right? Similarly, your heart, your left heart is getting bigger resistance. So heart will remodeling itself by left ventricular hypertrophy. Okay, so your left ventricle will grow in size. Okay, so each and every patients of essential hypertension who are having high blood pressure and that blood pressure is not controlled. Okay, either the patient is non-compliant to drug, the patient is not taking antihypertensive medication daily, right? Or the blood pressure is unchecked, the patient is not taking any medication. So gradually heart will modify itself, will remodel itself, right? And left ventricle will grow in size, okay, grow its muscle mass, so that power is increased and it can pump with more force and force blood into the systemic circulation, right? Clear? Okay, so what will happen now? So I am drawing only the ventricle. Okay, so right ventricle, left ventricle. Okay, so here is left ventricle. Normally its muscle mass is already more than right ventricle muscle, right? Normally left ventricular muscle is more, right, than right ventricle. Okay, now in a patients of essential hypertension, okay, peripheral resistance is high, so left ventricle will further increase in size, right? Left ventricle will further increase in size to get more strength to eject blood into systemic circulation, which is a very high resistance circulation now in a patient of high BP. Correct? Okay. Now what will happen to all those vectors? Number 4 vectors, which was responsible for depolarization of ventricular free wall, it will get bigger, because now it has to activate greater muscle mass than it was previously, right? Okay, so इसको depolarize करने के लिए, इस total muscle mass को depolarize करने के लिए, now you need a big vector, Okay, right. Now as number 4 vector will be bigger, okay, the mean axis will shift towards 4. Okay, this mean axis will shift towards 4. Okay, and sometimes beyond 4. Okay, we call it left axis deviation. Okay, we call it left axis deviation. Correct? Similar thing can happen in right ventricle when pulmonary vascular resistance is high. Okay, similar thing happen to the patient's right ventricle when when patient's pulmonary vascular resistance will be high. Okay, there are multiple causes of pulmonary arterial hypertension, you will gradually get to know, right? So when there will be hypertension in the pulmonary circulation, so it is very difficult for the right ventricle to eject blood into pulmonary circulation, then your right ventricle will grow in size. Okay, so now I am giving just the opposite example. Okay, now as there is pulmonary arterial hypertension, right ventricle will grow in size. Okay, so in this case, mean electrical axis, this green one, it will rotate in this side. We call it right axis deviation. Okay. Depending on the location of hypertrophy. Which part of the ventricle is getting hypertrophied? Depending on whether the hypertrophy is getting here or here or here, right? Shift. Okay. Correct. Okay. So now, if there is pulmonary arterial hypertension, there will be right ventricular hypertrophy, and as a result, mean electrical axis will rotate towards right. We call it right axis deviation. And when the patient is having systemic arterial hypertension or essential hypertension, right, then there will be left ventricular hypertrophy. As a result, the mean electrical axis will rotate towards left. We call it left axis deviation. Okay, so one cause, by now you know, one cause of left axis deviation is left ventricular hypertrophy, and one cause of right axis deviation is right ventricular hypertrophy, right? But there are other causes as well. Anyway, now the next question is, then what is normal axis, and how to understand axis? Simply by seeing an ECG. Okay, I will not tell it now, right? So first, what is normal axis? Normal axis is minus 30 to plus 110 degree. Okay, so normal axis is minus 30 to plus 110 degree, right? अगर इस जोन में आपका मेन इलेक्ट्रिकल एक्सिस है तो कार्डियक एक्सिस इज नॉर्मल. ओके, कार्डियक एक्सिस का कोई पर्टिकुलर वैल्यू नहीं होता है कि 60 डिग्री में है, 70 डिग्री में है, 45 डिग्री में है. ठीक है, 60 डिग्री इज ऑल्सो नॉर्मल, 50 डिग्री इज ऑल्सो नॉर्मल, 45 डिग्री इज ऑल्सो नॉर्मल, 40 डिग्री इज ऑल्सो नॉर्मल, 30 डिग्री इज ऑल्सो नॉर्मल, राइट? इट्स लोकेशन शुड बी विद इन minus 30 to plus 110 degree. Okay. If it is beyond minus 30, that means minus 20, minus 10, we call it left axis deviation. Okay. And if it is beyond plus 110 degree, that is 120 degree, 150 degree, 140 degree, we call it right axis deviation. Okay. And we can determine the axis from an ECG. Okay. We can very well determine the axis of the patient from the ECG. Okay. Gradually we will get to know. Okay. So now main electrical axis is clear to you, right? Okay. Now come to the ECG wave formation. So in case of, see, everywhere the concept of vector is important, right? So at the center of heart, we have all these vectors. Now, where are the location of the ECG leads? Okay. So here is lead 1. Do you agree? Here is lead 2. Correct? Okay. थोड़ा सा नीचे. Okay. So now let's form an ECG. So one rule I have already told in previous class, right? So if a vector travels towards the lead, okay, it will give a positive deflection, right? If a vector means depolarization vector, okay, so it is depolarization vector, right? And if a vector, depolarization vector, moves away from the lead, it will give negative deflection in an ECG, right? If repolarization vector, do you know what is repolarization vector? The heart muscles are coming back to the normal state towards resting membrane potential, right? So what is happening? Here is the SA node, right? Here is the location of SA node, and from SA node depolarization wave travels. Okay, depolarization wave travels. So from base of the heart, this is the base of the heart and this is apex of the heart, right? So from base to apex, heart is depolarized. But during repolarization, it will travel in the opposite direction. It is the repolarization vector, right? From apex to base. Okay? So a repolarization wave, when comes towards the lead, it will give negative deflection. And a repolarization wave moves away from the lead, it will give positive deflection. Clear? Okay. Now what is happening in lead 2? First vector coming towards the lead, positive. Second vector moving away from the lead, negative deflection. Okay. Third vector coming towards the lead, positive deflection. Okay. Now 4, 5 all together moving away from lead 2. This is lead 2, right? Negative deflection, right? Now repolarization. Repolarization moving away from lead. Repolarization moving away from the lead, positive deflection. Okay? P, Q, R, S and T. Okay, so this is your ECG, looks like in lead 2. Clear? Now the location of AVR, AVR कहाँ पर है बेटा? यहाँ पर है, ठीक है? Lead AVR. Now let's see how ECG wave will look like in the lead AVR. First vector moving away from the lead, right? Second vector it depends, slightly up or slightly down, right? Slightly up or slightly down, right? Then 3 moving away from the lead. Okay, 4, 5 altogether slight towards the lead, right? And actually these vectors can be divided. Okay, so if this is a vector, so you can divide it into cos theta, right, and sin theta. Do you remember this from your physics knowledge? Okay, so this is how the vectors are directed towards this, so somewhat directed towards this, right? Okay, and finally T wave. So a repolarization wave moving towards the lead, repolarization wave moving towards the lead, you get negative deflection. So this is the ECG wave looks like in lead AVR. Clear? But for standard description, we always look for lead 2. Okay, lead 2 is the standard lead where we do maximum analysis of ECG wave. Okay, okay, so आप मुझे ये देख के बताओ, P wave is due to, in ECG, P wave is due to atrial depolarization, Q wave is due to septal depolarization, R wave is due to apical depolarization, right? Cardiac apical depolarization. AS wave is due to combined 4 and 5. AS wave is due to combined 4 and 5 ventricular free wall depolarization and posterior basal part of the heart depolarization. And T wave is due to ventricular repolarization. Okay. Okay. Now divide your ECG into this. P wave, QRS complex and T. P wave, QRS complex and T. Right? P wave, QRS complex and T. So P wave is due to atrial depolarization. QRS is due to ventricular depolarization. T wave is due to ventricular repolarization. Never forget, right? P wave is due to atrial depolarization. QRS complex is due to ventricular depolarization, and T wave is due to ventricular repolarization. Okay? So anything if undergoes depolarization, it must be repolarized again. So ventricle QRS complex से depolarized हो रहा है, फिर T wave से repolarized हो रहा है. What about atria? It is getting only depolarized. Where is its repolarization? बताओ. तो हम लोग यहाँ पर देख रहे हैं कि P wave is not followed by the atrial repolarization complex. ओके, इसका मतलब एट्रिया डिपोलराइज तो हो रहा है लेकिन रिपोलराइज नहीं हो रहा है. वेंट्रिकल डिपोलराइज हो रहा है, रिपोलराइज भी हो रहा है. ओके, लेकिन एट्रिया, if it is not repolarized, it cannot go into depolarization again. ठीक है, सो एट्रिया को कॉन्ट्रैक्ट करने के बाद रिलैक्स करना होगा, तब जाके ये फिर कॉन्ट्रैक्ट कर सकता है, राइट? सो वेयर इज रिपोलराइजेशन और द रिलैक्सेशन ऑफ एट्रिया? Yes. So answer is important question. Explain why for your first professional MBBS. Why atrial repolarization wave is not seen in ECG? In ECG, we see only depolarization of the atria, but not the repolarization of atria. Why? Because atrial repolarization wave, there is atrial repolarization wave, but it coincides with QRS complex. And atrial repolarization wave is so small that it is covered, it is buried under QRS complex. ठीक है, atrial repolarization wave is so small in comparison to QRS complex. QRS complex is a huge complex, right? Okay, QRS complex is a huge complex, huge electricity is flowing throughout the ventricle, right? And that covers up the atrial repolarization wave. So it is buried under QRS complex. So we do not see atrial repolarization wave. Clear? Okay. Now, okay, intervals. Now next, in our next class, we will study few intervals. Okay, the normal, how normal P wave looks like, what is PR interval, what will be the length of QRS complex or the time span of QRS complex, then how normal T wave looks like, and what is QT interval and what is ST segment. Okay, these are also important. Okay, so whenever we interpret ECG, सोचो कि आप assume कि आप आपका क्लिनिक में बैठे हो and some patients take his or her ECG and gives it to you and you have to interpret. Okay, so आपको एक ECG पेपर दे दिया गया, बस और कुछ नहीं. ठीक है, now you need to report it, right? You need to report it. क्या क्या चीज देखना होगा? ठीक है, the ECG will be either in a long strip and nowadays a full paper is also available, right? Okay, so what are the points to see in an ECG? तो ये आप थोड़ा सा नोट कर लो, right? What are the points to see in an ECG? ECG से आपको क्या क्या चीज देखना है, राइट? सो नंबर 1 इज रेट. रेट मीन्स हार्ट रेट. ओके, हार्ट रेट हम लोग कैसे देखते हैं? हाउ टू सी हार्ट रेट? आप लोग कैसे देखते हो हार्ट रेट? पल्स. पल्स. ओके, सिंपली वी चेक द पल्स. द पल्स रेट इक्वल्स टू हार्ट रेट normally, but not in a diseased patient. It may be the situation that heart is pumping or generating depolarization, but the pulse wave is not coming here. Okay, we call it pulseless activity of heart. Okay, so then what will happen? Heart rate will be higher than pulse rate. Okay, heart rate will be higher than pulse rate. So to actually check the heart rate, we need to perform ECG, right? Okay, so from ECG, the first thing we check is the rate, or you can say heart rate. Next, we check rhythm. What is rhythm? Because when the impulse is generating from SA node, we call it sinus rhythm. Okay, and I told you in previous classes that in a college, principal is the top authority, right? So when principal is not working, or maybe the principal is in leave, so someone else from another department, maybe some departmental HOD, he is acting as principal. Okay, And even if he is not available, some associate professor or assistant professor is doing the job, right? So if someone is not there in the hierarchy, okay, someone from the lower level will take its action, right? Okay, so similarly, when SA node is not able to generate electricity, that means SA node is not working as pacemaker, AV node will take action. Okay, now the new pacemaker is your AV node, and sometimes AV nodes may also fail. Then Purkinje fibers may act as pacemaker, right? Yes, definitely heart rate will be reduced because your SA node fires at a rate of 72 to 100, right? Your AV node fires at a rate of 30-40, right? Purkinje fibers far more below, around 20, right? So it happens, right, in patients. So when the rhythm is coming from SA node, we call it sinus rhythm. We need to check the axis. We just discussed axis, whether the axis is normal or left axis deviation or right axis deviation. Okay, how to check the axis from ECG এখন শেখাবো না। আচ্ছা, rate rhythm axis, then P wave, whether P wave is normal or not. Next, PR interval. Okay, next QRS complex. Next, ST segment. Next, T wave. And number 9, QT interval. So these are the 9 points you need to check once you get an ECG of any patient. Okay, ये 9 points हम लोगों को check करना पड़ता है when we see or interpret an ECG. Okay, now in our next class, gradually we will discuss all the points: how to calculate heart rate from ECG, how to check the rhythm, how to check the axis, how to check whether P wave is normal or not, how to check the PR interval. What do you mean by PR interval? Yes, it is the time required for the depolarization wave to travel from atria to ventricle. Okay. Okay, anyway, we will discuss this later on. PR interval is very important because the concept of heart block comes here, right? When PR interval is high, that means the depolarization wave is taking longer time than usual for traveling from atria to ventricle. Okay, PR interval will be long, right? So definitely in an ECG, after P wave there is a long gap, then QRST. Okay, so this is long enough. Okay, so it essentially means that depolarization wave is taking longer time to reach from atria to ventricle. So there must be some abnormality in between, right? At the level of AV node or at the level of atrioventricular junction, there is conduction block. Okay, okay.